Welcome to another episode of Believe in Balance. We're going to talk about the dreaded F word in aging, which is the fear of falls or falling. I feel very confident to discuss this topic with you today, as I'm a PT and we as physical therapists are experts in balance, mobility, and fall prevention. But with that said, I need to read our disclaimer. This podcast episode and my associated articles and webinars on balance are intended for informational purposes only. I am not providing legal or medical advice, and this information offered does not create a provider-patient relationship. Do not rely on this for medical information. Always seek the help of a qualified medical professional who has assessed you and understands your own unique condition. So let's talk about it a little bit. This is a topic that I work a lot with clients, especially in the fall. It's cold going into winter, fears of falling increase. So, it can happen to anyone at any time, but the fear of falling increases as we age. And certainly acquired neurological conditions like having Parkinson's disease, MS, or multiple sclerosis, as well as having had a stroke, also put us at higher risk of falling. I've heard many of my patients refer to their own concerns about losing their balance and their fears associated with it as paralyzing. And I think that is a very fitting way to describe it, because it can indeed be paralyzing. I'm sure you've also heard a friend or a family member who was injured by a fall. Add the colder and slippery weather, especially as we are in the middle of winter here in New England, and this only raises these fears and often is the reason emergency room visits see an increase as fall cases really explode in the winter. The CDC, or the Centers for Disease Control, they're the folks that monitor this type of stuff in the US. They report every year that over 36 million falls occur in older adults. And this number has risen by 30% in just the last decade. So this is indeed getting to a level where it's an epidemic. And surprisingly, less than half of these fall victims tell their doctor, and many of them, including my own clients, will reveal to me privately they have fallen, but also share that they haven't told anyone in their family, mainly because they are afraid of losing their independence or needing more help. So as a result of these high costs of treating falls and the medical complications associated with it, fall prevention is now being incentivized to encourage healthcare providers to measure and ask about falls more regularly. And that's one of the reasons why I developed my Otago fall prevention program is part of my Achieve Balance course. And I spend a lot of time each week helping my clients learn about their risks of falls and work with them to build back their confidence so they can believe in their balance again. It all begins with education. In this podcast, I'm explaining I'm expanding my reach to you, or to just reach out to a loved one for more information to help you better understand the components of your balance. And the good news is, I started with all the bad news, but the good news is that you can restore your balance confidence with some simple steps. So, to keep ourselves upright in space, we need to know more about what happens when things fall apart and we break down, and some certain systems that get impaired can help us either restore our balance or help us retrain those areas that are needed to communicate with each other and act in a very unbelievable system of synergy. And those three body systems are the vestibular system, the somatosensory, which is basically another big word in proprioception, or your muscles and your ligaments and your joints, and the vestibular system. So I'm going to describe each of them briefly and how they influence our total balance picture. So the visual system first. This is our most heavily relied upon balance system, and that's within our eyes. Have you, ever closed your eyes to shower and felt like you had to grab on or hold on to something so you didn't fall? Have you ever had the lights go out and perhaps maybe in a dark area like a basement and you felt extremely disoriented and maybe got paralyzed, as that we described at the beginning? That's because when you close your eyes, you are no longer able to use your visual system, so that system is taken offline, and that helps us determine where you are in space. You then have to rely upon your vestibular system and your somatosensory systems to keep yourself upright. Another way we use our visual system is by being able to focus our gaze on a stationary object. For example, ballerinas use this as their visual system by focusing on a stationary object every time they turn so that they can keep their balance and not fall. Our visual systems give us so much information to be able to keep us oriented in space. So the next system is our somatosensory. It's also known as our proprioception, as I mentioned, another big word, but I'm going to talk a little bit more about it. These are just fancy words for the receptors in our nervous system, including our muscles, joints, and skin. This is why it's harder to walk on sand rather than on concrete. Another example is when you are standing on one leg and say, I just need one finger to balance. This is because the receptors in the point of that finger are activated and are able to tell you where you are in space while giving you a point of reference. You can use that challenge as an assist when you are looking at restoring this system as well. These receptors can sense changes in pressure, movement, stretch, pain, touch, and more. These senses are sent back to our brain, and just like our other systems, tell us where we are in space. The easiest way to stand is with a wide base of support, with our feet shoulder width apart or wider. As we bring our feet closer and closer together, it gets harder and harder to balance. Therefore, having our heels and toes touching becomes even more difficult. If we place one foot in front of the other in tandem, this is even more challenging. And the hardest way to stand is on one foot, but having this ability is very important to prevent falls, and one I use extensively in training in my Otago and fall prevention achieve balance course I mentioned. One of the simple assessments I do when checking balance is to challenge these different foot positions in what is referred to as the 4-stage balance test. So the third system, the vestibular system, is a bit more complex. And the home of the vestibular system is within our inner ear. It works to control orientation of our head and our speed of movement. I often refer to the body's vestibular system as our built-in GPS, or global positioning system, or a navigation system. It works remarkably well when it's on, but when it gets miscalibrated and misfires, it can indeed leave us incapacitated and spinning. Oftentimes, we need to work with a health professional at that point to bring things back online and recalibrate things again. So I'll try to just briefly explain the vestibular system. We have a left and right inner ear, and you cannot see your inner ears by shining a light into your ear canals because they are actually inside the skull. It's deep within the brain. This is thus the system is surrounded by another layer of bone. And there are two major parts of the vestibular system: the semicircular canals and the vestibule. So I'm not going to go into detail here, but we do a deeper dive in the full course on Believe in Balance and our Achieve Balance module on balance restoration. But when the vestibular system is really helps you, as I mentioned, it senses acceleration movements, like when you move up and down or back and forth. Think of it, that feeling you get in an elevator when you accelerate quickly in the car. The vestibule is where the dense calcium carbonate crystals known as otoliths, they live in this sticky gelatinous layer. In their home and where they like to stay is deep in the ear, but the crystals can get knocked off of their sticky layer and they end up floating in this fluid within the semicircular canals. And this is what ultimately makes you feel dizzy. I don't want to get into too much detail, but for those that have experienced this, this is known as benign paroxysmal positional vertigo, or you may have referred to it shortened as BPPV. And someone might report to them, their medical professional, that the room is spinning when this is, when this system is offline, and they have no control of their movement. You will see eye movement sometimes called nystagmus. That is a clear indicator of BPPV as well. And again, this is when you need to receive professional help to recalibrate the system, usually in a series of corrective exercise movements. Some people will have experience maybe with using what's called the Epley maneuver to correct and reset those crystals. So I want to just talk briefly about putting it all together and how these systems integrate. The integration and communication between the vestibular, visual, and somatosensory systems results in our ability to balance, maintain postural control and equilibrium. And these are all common descriptions used to remain upright and navigate our world safely and avoid falling. The central nervous system, our brain, and our spinal cord integrates these systems together to maintain our balance, or appropriately be able to react when we lose our balance. And the reflex between our inner ear, our vestibular system, and our eyes, our visual system, is logically then called the vestibulo-ocular reflex, or VOR. And this system allows us to walk and read signs at the same time, do more complex tasks, even like riding a bike, for example. VOR exercises are common prescription for those where the communication between the inner ear and the eyes are not as strong. And that's where working with a physical therapist or health professional skilled at doing this type of training can help you improve these weaker areas. And interacting with the VOR is another what's called a cervico-ocular reflex, which senses your head movement in relation to the rest of our body in space. Again, this often happens as we walk and turn our head when we are walking up and down, maybe the grocery aisle, for example. And then let's talk a little bit about your balance reaction in integrating all this, because the loss of balances will inevitably happen. We may trip on a rock or walk over a slippery surface, and how we react is very important and can keep us from falling. So we have 3 systems and strategies that we use now. And the 3 are ankle strategy, hip strategy, and your step strategy. If we get a little off balance, we use our ankle strategy to correct, and we either, we can either go up on our toes or back on our heels to keep ourselves upright. Then we may get knocked off balance even more, and that requires us to turn on our hip strategy by bending our knees, our hips to align our center of gravity. And finally, if we really get off balance, we'll have to take that step to keep from falling. So all 3 of these are important. And we need only, one of these strategies or all 3 to keep ourselves from falling, depending on the amount of disturbance or the challenge that we face. If we do not practice these, however, then it becomes harder for us to utilize them, and we actually need to call them in to help us. And that's one of the things that I've realized in practice is we don't challenge our balance. We take it for granted, and we wait too long to incorporate exercise, balance retraining into our everyday activities. And that's what my course is about. The Achieve Balance and the Believe in Balance module will go into those exercises that are most effective at retraining balance. The good news is, good and bad, you use it or lose it. In clinical practice, I often see older adults who are afraid of falling because they tripped over something. They had a recent surgery or had a stroke, for example. They have a friend maybe who fell and was seriously injured. Or there's what develops as a post-fall syndrome, literally a fear of falling after experiencing a significant fall again, that it could happen. And the ultimate response would be that don't start to challenge yourself and you become more rigid, and ultimately sets the stage for, certain um, compensations, if you will. Often, what you'll find is that person will start holding on to walls, cabinets, railings. Whenever walking on unsteady surfaces, they may kind of tighten up and not um, really challenge their self. And oftentimes, pretty soon they end up having to place furniture throughout their home so they can hold on when traveling through their rooms. We call this in PT furniture surfing, and often they don't even realize they're doing it. So we install, night lights throughout our home. We hold on to our gaze on stationary objects when our balance is challenged. All of these tasks are decreasing the use of our balance systems. They're going to keep us upright, but they're not helping us to retrain. So when you work with a health professional, usually they'll have you challenge those habits and get you to make movement less paralyzing again. And we become less active as a result of not, facing these fears, and we avoid our prior level of activity. We often don't um, don't go out as often. And long-term exposure to this reduced activity is linked to functional decline. That's the bad news. So most loss of balance issues can be blamed on sitting and sedentary lifestyle choices. And while seated, our balance systems are certainly not being utilized. So the loss of use causes loss of function. So, how can we prevent falls for yourself or a loved one? Get screened is the first thing. Talk about it, reach out, schedule an appointment with a licensed physical therapist to have your balance assessed. As I mentioned, I use the Otago mobility assessment and screening in my practice. I have a video out there that you're welcome to watch as a resource on how to do these simple tests. And I used the three mobility tests to help develop a fall prevention program, first by knowing what areas needed addressing, and then, directly correlating that to the person's needs. Um, these tests that I use are, if you've watched the video, you already know this, it's the timed up and go, the sit to stand test, and the 4-stage balance. And I discussed them in a video demonstration, so I'm not going to go into detail here. So, final other tips, a body in motion stays in motion. This goes for our bodies too and our balance systems. So, stay active. There's not a pill for helping maintain balance, but there is what I refer to in my book, Body and Balance, is the e-pill or exercise. And I use the Otago exercise program with my clients, and there's really a series of 17 strength and exercise endurance exercises that are specific to some of the deficits that are found that I incorporate in the corrective exercise program for my clients. So you should also think about having regular eye exams to ensure your visual system is working optimally. Have routine foot checks to ensure proper sensation or else your proprioception. And that relates to your footwear choices as well, which we go over more in the course. And have regular medication checkups. Being on 2 to 3 or more, which is medications, also known as polypharmacy, puts individuals at higher risks of falls. Certain classes of medication also put individuals at higher risk. So you want to improve your home environment with proper lighting, decrease clutter, and throw rugs, install handrails on stairways. That's another thing I do as a certified aging in place specialist. I do assessments for individuals in their home. It could be as simple as installing grab bars in the bathroom, utilize training, make sure your pets are not trip hazards. And, we're not going to go into it on this episode, but, nutrition is another big part of what I do. And things as simple as nutritional deficiencies, vitamin D is one, can lead to um, poorer, poorer outcomes in terms of nutritional status for creating perhaps a situation that will put you at a higher fall risk. So much more on that in my course as well. So quick PT tip and a takeaway, if you're observing a loved one or you're, listen to this episode and want more information, or you're maybe thinking there is some deficits that need addressing, one quick way you can maybe think about this is there's an interesting fact about walking and falls. So we've known for a long time, about 20 years, that older men and women who stop walking when a conversation starts, they are a particularly higher risk of falls. And over a 6-month time frame, few of those who could walk and talk at the same time will go on to fall, but about 80% of those who stopped when a conversation was initiated ended up falling. So this is a casual way to pick up on any concerns you might have for a loved one's balance, by observing them in conversation with you. And I think that's where I'll leave it on this episode. In future um, podcast episodes, we'll talk a little bit more about the actual exercises that are part of the Otago and my Believe in Balance course. But for now, I just wanted to leave you with a way of understanding the parts of control for your balance system. And my final message is don't wait till fall, start training your balance today.